U.S. Surgeon General Jerome Adams has been meeting with community groups to encourage measures like mask wearing and social distancing and overcome mistrust of vaccines. First on CBS This Morning, Dr. Adams will also tell us about a new effort, and this is so important, to protect pregnant women and new moms. So good morning to you, Mr. Surgeon General. Before we get to this new effort, I do want to talk about the comments yesterday by CDC Director Robert Redfield. He said we could be facing the most difficult period in the public health history of this country. That actually echoes something he said way back in April that the president criticized him for, said he had been misquoted. When you think about those two data points, is there anything that you wish the task force or you yourself personally had said or done differently to avoid this crisis that we're in right now?
Well, you ask a fair question. And I think I wish that I, and I can only speak for myself, had done a better job of communicating the uncertainty of this virus. Remember, we're still learning about it. We're learning new things every day, and you saw new CDC guidance on quarantine and on testing come out. And I have to admit, that has confused the public when they hear one thing one day and it changes a few weeks or months later. But I want people to know that the scientists are working hard around the country at the CDC and at the FDA to give you the best recommendations based on what we know now and to continue to shift those recommendations as the science warrants. And I want you to know that we have great science that says wearing a mask and watching your distance and avoiding contact outside of your household will work to blunt this surge. Yeah. And there's hope. We're almost to a vaccine.
We are.
So just hang on a little bit longer.
Dr. Adams, I always appreciate your straight talk on this. So I want to pick up on one more thing that Dr. Redfield said. He said it was a problem, his word, a problem, that in the summer, in July, we were still debating whether we should all be wearing masks or not out in public. In addition to that problem, what else stood out to you about the federal response to now?
Well, one of the things that's challenging in our country is that we have a federalist system of government where all the states make up their own minds. And so one of the things we've actively tried to do as doctors on the task force is go out to states. And I'm high risk myself, but I've been to states all over the country. Been to Cleveland, been out west to Oklahoma, been all over the place trying to help people understand their numbers on the ground, and we're seeing it work. You hear a lot of doom and gloom, but more people than ever are wearing masks. Mm-hmm. You saw holiday travel actually decrease this year compared to last year, and so I want to congratulate those people and tell everyone else, hang on, because we are in the midst of a really bad surge, but what we do today will control what happens weeks from now.
Hang on, there is light at the end of the tunnel. Dr. Adams, it's good to see you. I want to talk about your call to action to reduce maternal mortality in this country. I think many people would be even surprised to hear that it is an issue. What are you here to tell us about that?
Well, Gail, thank you so much for the opportunity. We have a COVID crisis in this country. But I want people to know we have a maternal health crisis in this country also, with a woman dying, a mom, a mother-to-be dying every 12 hours due to pregnancy-related complications. This is worse than many other developed nations, and it's getting worse because of COVID-19. But I want people to know this is unacceptable, but it is not inevitable. The CDC says 2/3 of these deaths are preventable.
And it's higher, I'm told, in black women. Why is that? And what should we be doing about it?
Well, this is just shocking to me as a father of a young woman, as a husband of a wife who's high risk. And my sister right now is pregnant, and she is at high risk. And I want people to know that black women and American Indian, Alaska Native women are 2 to 3 times more likely to die versus white women. And it doesn't matter if you have a PhD, like one of my own public health service officers, Shalon Irving,
who
died due to hypertensive hypertension.
Why is that happening?
Well, we know it's happening in many cases because these women aren't being heard. And so I want to call out the Joint Commission's Speak Up campaign. We're really trying with this call to action to empower women to speak up, but we're also telling people to listen to women. We know there's bias. We know there's, quite frankly, racism and legacies of racism that mean people aren't heard. And it doesn't matter if you're Beyonce. Beyonce had severe preeclampsia, or Serena Williams, the best athlete in the world, almost died due to pulmonary embolism. We need to do a deeper dive into these root causes. We need to really empower women to speak up, and we need to listen to them. So I want people to go to surgeongeneral.gov check out my call to action, because it's not just about the women. It's about what we do around them. Employers can provide breastfeeding and more supports for women.
We have the best
we all have
healthcare
a role to play.
Thank you, Dr. Adams. He's right. Thank you.
We have
He's right about Serena Williams.
He is. We have the best healthcare system in the country, but everyone needs access to it equally. Surgeon General, thank you very much. Jerome Adams, we appreciate it.